So what I'm going to do next is, like I said, I'm just going to gently soften the appearance of her face. She's got a lot of concavity here that's contributing towards a lot of this loose skin and this sagginess. So I'm just going to sculpt the face with a 25 gauge cannula that is 2 inches long. So that is not about filling somebody's face and making somebody's face look bigger. It's about just gently softening all the silhouette of the face, hopefully make her look about 5 to 6 years younger. You're not going to see groundbreaking change in her because she's already a beautiful woman. So once that's done, we'll do a little bit of nasolabial fold. I don't normally draw that out. We can do that here. And then picking entry points. Remember I mentioned we are going to have 5, maybe 6 entry points, and it will be guided by the length of your cannula. My cannula is about just under 2 inches long, 50 millimeters, so just under 2 inches long. So I'll palpate for the infraorbital floor. You don't want to go above that. And I will have a little dot here, because that's about 1.5 inch long. And this will serve 2 purposes. One, sculpting the zygoma. Diagonally up is an inverse tick. Second, it will address the infraorbital floor. Whilst I'm there, I would just like to point something out. You can't quite see on the camera, but can you see there is a little bump here? Okay, and there isn't on this side. So I'm glad the daughters are here to listen to that, because it can come across as thinner, especially on the other side there isn't. So I usually point that out to patients first. I get them to feel it. That can come across as thinner. See? So we want to go into the deep fat compartment, bevel up, pinch the skin, and then push a little. And then we try to find the right plane. Good. Can you see that it glides when you're in the right plane? Not much pressure. I'm going to demonstrate if you are in the superficial plane. Can you see that? Can you see that? The tenting. This is superficial plane. This is deep. And Eva will tell you that there is very little discomfort. And there was very little resistance. You saw that. I didn't have to push hard. So if you're in the right fat compartment, it glides. And the advantage of cannula, as you can see, is if I'm in the wrong plane, I'm not going through. See, I'm not even pushing, but there is resistance. Can you see that? I can't get through, and I'm not going to push hard. So a lot of people use anesthetic so they can push hard, but no, if you're in the right plane, you don't need to push hard, and cannula will tell you that. So I adjust. There you are. I'm in now.